Hello, my name is Sarah. I'm a registered nurse, and I welcome you to my third video of the series that I'm doing titled The Risk of Abortion. Today our focus is going to be on the physical, mental, and emotional risk of abortion. Now, the first video that I did in this series, I shared a film titled To Save a Life, and that's a film that shares information from those who have worked in abortion clinics, who've experienced abortion, and they share their stories. And so if you haven't seen that first film, To Save a Life, on my first video, I recommend you go back and watch that one. Then the second video that I did, the focus was alternatives to abortion for women who are experiencing an unplanned pregnancy, but really don't want to have an abortion. I need to know what options that are out there. So that's what the focus of the second video was. But and then I'm going to continue on after this video and do a video on the spiritual risk of abortion. And then we're going to have my last video of this series is going to have a time of healing for those who've already had an abortion, who regret having the abortion, experiencing mental, emotional pain because of that, and that's going to have an opportunity for healing for those, for you, if you've already you're experiencing that. So I thank you for staying on and watching the physical, mental, and emotional risk of abortion. Today I'm going to do a brief overview of the physical, the risk of abortion, as well as the mental and emotional risk. And I'm utilizing a website, birthmotherministries.org. And I'll have the link for this website below the video. So if you want to get more information, I'm not going to share everything that's on that page. So if you want more detailed information, just visit the link below the video. Now, about 10% of women who have a first-time abortion face immediate physical complications. Now, this is according to a study reported in the American Journal of Public Health and the Journal of the Royal College of General Practitioners. Most physical complications develop as a result of an incomplete evacuation of the uterus, infection, or injury from instruments used during the procedure. The risk of complications rises significantly when abortions are performed in the second trimester over the first trimester. So always keep that in mind as I'm going through these risk factors, that the further along you are in your pregnancy when you have an abortion, these risk factors can increase. The first one is that you can, I'm going to talk about is excessive bleeding. Now, some bleeding after an abortion is normal, but when excessive or uncontrolled bleeding occurs after an abortion, often from a torn cervix or punctured uterus, a transfusion may be required. Now, the pill, the RU486, increases risk of heavy bleeding, with 1% of users requiring surgery to stop the bleeding. You also run a risk of infection. A pelvic infection can lead to high fever, hospitalization, and pelvic organ scarring. Moreover, the pelvic inflammatory disease can also develop. This is caused by bacteria entering the body during or after an abortion and can spread from the cervix to the uterus. Also, the fallopian tubes and the ovaries can experience infection as well. Now, fetal or placenta parts left inside a woman's body, known as an incomplete abortion, can breed infection. and can necessitate repeating the abortion procedure. A number of RU486 users have died as a result of sepsis, which of course the sepsis is when you have total body infection. So that's serious. Now, another thing that can develop with as a risk factor with having an abortion is what they call an incompetent cervix. Now, during a normal pregnancy, the cervix remains tightly closed until term when the baby's ready to be delivered. An incompetent cervix is one that undergoes premature opening during pregnancy. It is also referred to as cervical incompetency. This is when the forcible opening of the cervix from repeated abortions can damage or weaken it, causing miscarriages or difficulties in sustaining the weight of the baby in subsequent pregnancies. So basically, from your cervix just won't close properly because it being forced open to remove when you have an abortion. It damages it. Another problem, another risk is perforated uterus or bowel or even bladder. Abortion instruments can puncture abdominal organs, requiring emergency surgery to repair the damage. Occasionally, perforation requires removal of the uterus, a hysterectomy. Perforation of the uterus and cervical lacerations are two of the most common complications of abortion. This is due to the fact that most abortions are by suction aspiration, a procedure where the doctor essentially goes in blind. So that means, in further pregnancies and future pregnancies, these injuries can result in premature births and labor complications. Although less common, serious injuries have also resulted from the perforation of the intestine or other organs by an instrument used in abortion. So that's pretty serious. Scarring is also another risk. A fertilized embryo seeks to implant itself in the soft lining of the uterus. Suction tubing, curettes, and other abortion instruments may cause scarring of the uterine wall if an infection is present at the time of the abortion. Scar tissue may prevent the embryo from implanting, leading to miscarriage or other complications in subsequent pregnancies. Another risk factor is sterility. Women who have had abortions more than double their risk of future sterility. Another risk is ectopic pregnancies. Abortion increases the risk of subsequent ectopic pregnancies, and of course that's where pregnancy that develops outside the uterus. Of course, most often it's in the fallopian tubes. Ectopic pregnancies in turn are life-threatening and may reduce fertility. Then there's also complications with the use of general anesthesia during an abortion and can lead to loss of uterine muscle tone, which can cause excessive bleeding and hemorrhaging. Other potential complications include hypoxia, where the whole or part of the body is deprived of adequate oxygen supply, and breathing difficulties. Local anesthesia complications include seizure, cardiopulmonary arrest, allergic reactions, or severe whole body reactions. So that's serious. Of course, there's always a chance in these procedures of death. Recent statistics from the Center for Disease Control report fewer than one death per 100,000 legal abortions due to complications. Though rare, abortion can directly cause death as a result of bleeding, infection, organ damage, and other complications. Long term, women who have abortions are four times more likely to die within the year following their pregnancy than women who carry to term. And most causes, though not all, are associated with risk-related behavior, including suicide, injury, accident, and homicide. So that's just a brief overview of the physical risks of abortion. Now I'm going to continue on, and we're going to talk about the psychological and emotional risks that they've that can be associated with having an abortion. A significant number of women experience psychological and emotional difficulties after an abortion. A recent study found that more than 85% of women who aborted reported at least one negative reaction to abortion, such as sorrow, grief, regret, or disappointment. About 35% reported 5 or more negative reactions, and up to 10% of surveyed women developed serious psychiatric complications. Now, depression and anxiety is a high risk. Women who have experienced abortion have a 65% higher risk for developing long-term clinical depression than non-abortive women. Women with no history of anxiety are 30% more likely to develop generalized anxiety symptoms after an abortion. Substance abuse is a risk. Women with no prior history of substance abuse are 5 times more likely to abuse drugs and or alcohol after an abortion than those who give birth. In one study, 60% women admitted to increased alcohol use after an abortion. Sleeping disturbances. Now, more than 1/3 of aborting women experience sleep disturbances as well as nightmares. Eating disorders. 39% of the post-abortive women battle subsequent eating disorders, including bulimia, binge eating, and anorexia nervosa. Smoking. Women who abort are twice as likely to become heavy smokers. Suicide. A study reported post-abortive women were 6 to 7 times more likely to commit suicide in the following year than were women who gave birth. Now, there's also a psychiatric problem diagnosis called post-abortion stress syndrome. Short, they call it PASS. And women who have experienced abortion and who present a specific set of symptoms are diagnosed with PASS. Now, this is widely accepted as a subset of the post-traumatic stress syndrome, a condition triggered by a traumatic experience that renders the victim unable to cope. So, PASS symptoms include depression, inability to function normally, inability to manage personal responsibilities, self-harm, self-destructive behavior, suicidal thoughts or activity, and the desire to get pregnant. Additional psychological and emotional risks associated with abortion include difficulties with normal functioning, like maintaining school, job, or family responsibilities. Also, child abuse, avoidance behavior, irritability, outbursts of anger, and violent behavior. So like I said, that's a brief overview of the physical risk of abortion, as well as the psychological and emotional risks that are involved with women who have had abortion. This is after surveying women who's had abortion, this is what they're finding that they're dealing with afterwards. So that's the end of the information at this time. Like I said, if you want more detailed information, because I didn't talk about all the risks, there's some risks I didn't include. So if you want to read about all the risks, just look at the link below the video to get a list of all the risk factors. One more thing I do want to add is that during when women have an abortion, they do experience pain. Some experience intense pain during an abortion. But I know a lot of women have the question, well, does the fetus inside, does it experience any pain during the abortion? Dr. Robert J. White, a professor of neurosurgery at Case Western University, says that babies at 20 weeks gestation is fully capable of experiencing pain without a question. Abortion is a dreadfully painful experience for any infant subjected to such a surgical procedure. Also, Dr. Paul Ranalli, a neurologist at the University of Toronto, says that unborn babies have a heightened sensitivity to pain, because unborn babies at 20 weeks development actually feel pain more intensely than adults. This is a uniquely vulnerable time, since the pain system is fully established, yet the higher level pain modifying system has barely begun to develop. So what that means is their pain is intense, more intense than what we adults would feel. I mean, so here, we wonder, because a lot of times we have this belief, when taught that it's just a blob of cell, or the baby, it's underdeveloped, so it's not going to feel pain. But that's not what they're saying. 20 weeks, at least 20 weeks or more, or older, they feel intense pain. So now you know that these babies are feeling pain, and so take that into consideration when you're contemplating having an abortion. Up next, a woman who had an abortion years ago shares her experience. So please continue watching the video to hear her story. Thank you.
I grew up in Ohio, in a little town called Johnstown, farming community, in church all the time. Gotten the best grades, and I never got in trouble. Nobody knew. I knew. My name is Casey, and I had an abortion when I was 19 years old. My college roommate helped me. She tracked down the place and took me. The room was so bright, and it seemed like it should have been dark. And oh, it hurt so bad. And the sound, just this horrible sucking sound and all the pulling. And so those are the things I remember. And we had to leave by the back door too. And I just cried and cried all the way home. And then from that point on, no, I just zipped it up. And I didn't talk about it. And it, embarrassingly enough, would raise its head at inopportune moments, sitting in church, so maybe Sanctity of Life Sunday or whatever. And then, I'd be a basket case. It doesn't ever go away. You think that this is the answer, It's secret, nobody knows, and it just never goes away. It's as permanent a decision as if you parent that child. It lasts you for the rest of your life. And I probably don't look like good can come out of it, but Isaiah 61, 1 through 3 talks about how he comforts those who mourn and give beauty for ashes, and he does do that. I don't have my baby. I'll never have my baby until heaven. But my hope and prayer is that by telling someone somewhere is going to maybe keep a baby and not make that choice, that gives my baby dignity and meaning and purpose to his life that I took. So that's good. That's good. That's the beauty that comes from the ashes.